Okay, so the fourth step when there's a challenge in treatment is identifying the client's therapy interfering cognitions. Now, it's important to recognize that patients' behaviors always make sense once we know what they were thinking. And we've just gone over the cognitive model, and it's really kind of a simplified version, but it's one that we can present to patients to help them understand themselves why it is that they have the reactions that they do. I was treating a patient named Andrea. I was asking her about finding a job, and I saw that all of a sudden she was looking very angry. Her body got very tense, and she looked down. She wouldn't make eye contact, and she wouldn't speak. Well, again, her behavior makes perfect sense once we understand what she's thinking. And what Andrea had been thinking was, Judy probably thinks I haven't tried. She's judging me. Well, no wonder she became so angry. And we also talked earlier before about the themes in clients' automatic thoughts and how they make sense once we know what their core beliefs are. It was illustrated in this diagram. Now, Andrea's core beliefs were that she was vulnerable, incompetent, and unlikable, and she saw other people as critical, harsh, and superior to her. Now, if she saw other people that way, then of course, when she comes to treatment, she's going to see me that way until I strongly provide evidence to the contrary, because I fall in the category of other people. She got, again, very angry at me when I asked her if she wanted to consider reaching out to her brother, because these core beliefs became activated, and her automatic thought was, you don't understand how painful it is for me to talk to him. Okay, now there are 4 categories of assumptions that kind of give you a shorthand way of trying to figure out exactly what a problem is. Now, we have just seen these experientially. We haven't done research to support these, but I think that they make a lot of common sense. And it goes like this. If I engage in treatment, then it will mean something bad or something bad will happen. If I engage in treatment, I'll have to change. Or if I engage in treatment, my therapist will be the superior one and I'll be inferior. And there might be 30, 40 different ways that any given patient might answer this. If I let myself experience negative emotion, it's usually I'll end up in the hospital, I'll fall apart, I'll be so upset I won't be able to stop crying, I'll just feel crazy. Another one is if I try to solve my problems, usually I'll just fail because I'm so incompetent or helpless. And finally, if I get better, my life will get worse in some way. I'll lose my therapist, I'll have to go back to work, I'll have to face the fact that I'm in a terrible relationship, and so forth. So if you're having a problem with a patient, it's a little hard to specify what's going on. You might ask yourself, does the patient seem to have an assumption in any one of these categories? Okay, now we're going to talk about the therapeutic relationship. If there's a problem in the relationship, there are all kinds of behaviors that the patient might engage in, all kinds of things that the patient might say or not say. So here's how to avoid a challenge. Assume that the patient, before you meet the patient for the first time, probably doesn't feel safe or not completely safe, and do whatever you can to help that patient's sense of safety. Here's another one that's very important. Treat every client at every session the way you would want to be treated if you were a patient for the whole rest of your career. You want to just be a nice human being in the room with the client. And you want to have realistic expectations for the patient. Patients are supposed to bring up lots of challenges in treatment. That's why they're patients. Also important for you to have realistic expectations for yourself. And if you think that I'm able to help every patient whom I treat, you are sorely mistaken. I've gotten a lot better at it as the years have gone by, and I certainly learn from every patient that I see. But when I was starting off, I would just sit in the therapy room thinking, oh, my father could do this so much better than I could. So that was not a good expectation for me. And I realized it was just making me feel anxious. But when I compared myself to my peers instead of to my father, then the anxiety went way down. So maintain realistic expectations. Give rationales for what you would like to do. depathologize patients' problems. I often say, it sounds like you just don't have very much confidence in yourself. Provide evidence for realistic hope. This is why I think you're going to get better. Tell me what you think about this. Foster collaboration, seeking an agreement on what problems or goals you're going to work toward and how you're going to reach those goals. You're going to share the conceptualization and the treatment plan and elicit feedback. You want to be sensitive to patients' cultural practices, spirituality, and so forth. Very important to use good Rogerian counseling skills, but you need to titrate it for various patients. There are some patients who really thrive when you give them a great deal of empathy. Then there are others who have a sour look on their face the first time you make an empathic statement because they just don't like it. And so it's very important to take your cues from the patient in titrating these Rogerian skills. I tend to use self-disclosure in just about every session with every patient. Often, if the client is telling me something positive that happened during the week and I've had a similar experience, I might say something like that. If a client has a particular problem and I've had that in my lifetime, I might say, I had a similar problem, but I think it was, of course, much milder than yours. Would you like to hear some of the things that I was able to do? But using self-disclosure really makes the therapeutic alliance much stronger with most clients. You want to be very conscious of their emotional reactions as you're sitting in the session with them. And often when you notice that they are looking a little bit more upset, you need to call attention to that. Oh, you're looking a little bit more distressed. What was just going through your mind? You want to elicit feedback at the end of the session too. At the beginning, you can say, what did you think about today's session? Is there anything you thought I got wrong or anything you want to do differently? After a couple of sessions, and you're sure that the patient will give you really honest feedback, then you can just say, what did you think about the session? Whenever the patient gives you negative feedback, the first thing that you ought to say, though, is, it's good you told me that. And it is good that the patient tells you when he has negative feedback, because if he didn't, the problem just might go on, and you would have no ability to address it. And you need to say that even when the patient expresses automatic thoughts that are untrue, such as, you don't care about me. But the first thing that you need to say, oh, it's good that you told me that, and then you need to figure out a strategy to use. And you want to work collaboratively, of course, to help patients not only reduce their symptoms, but what's very important in recovery-oriented cognitive therapy is to increase positive emotion right in the therapy session itself and between sessions. Okay, how do you know if the client has a problem with you, and what do you do about that? We just mentioned before, you monitor their affect, and then you reinforce them positively for telling you the problem, and you plan a strategy. If you've made a mistake, it's a good idea to model apologizing and doing problem solving. If you haven't, then you might summarize the patient's automatic thoughts in the form of the cognitive model and ask if it's okay if you and the client together take a look at the thought to see whether the thought is 100% true or 0% true or someplace in the middle. Now, it's often helpful, especially with personality disorder patients, when a problem in the therapeutic relationship does arise, because this is where the client can really do some important learning about your relationship with them. And then you can ask them whether they've had a similar problem with anybody else outside of the therapy session, and help them apply what they've learned from your relationship to this other relationship.